within carbs, you have some people still talking about gluten intolerances and gluten sensitivities. And so outside of celiac disease, where you obviously can't have gluten, do you think there's anything to the whole gluten sensitivity thing? Because I think most research shows no, but you have this, huge group of people who do seem to believe it. And whether or not it's actually the gluten, or maybe when they took out gluten, they're removing other ingredients, they seem to feel better for whatever reason. So why do you think that is?
Well, that's a great question. I think one of the studies that came out that tried to show that there was actually people that could have non-celiac gluten intolerance. What they basically did was they exposed people for gluten, and then they didn't expose them for gluten, but the subject didn't know when they were exposed for gluten or not. But what they didn't account for was that there's been a ton of research showing that if you eat foods that are so-called low FODMAPs food, which is basically the diet you follow if you have irritable bowel disease, and it seems to be working really well for a lot of people. I saw a review that was published in 2015 that showed that 80% of IBS patients that follow a low FODMAP diet actually see improvements in their symptoms.
Yep.
And FODMAPs is basically carbohydrates that some people can't digest optimally, so they get issues like gas, crampings, diarrhea, etc., etc. Well, what they didn't account for in that first study, where they concluded with, well, some people can have non-celiac gluten intolerance, they didn't control for the FODMAPs. So they did a follow-up study where they actually controlled for the FODMAPs. So they removed all the high FODMAPs food. They were eating a low FODMAP food, and then they actually exposed them for gluten. And the subject didn't report any ill symptoms. So it does seem to be the case of maybe it's more the FODMAPs and not necessarily the gluten that's causing the problem for a lot of people. Because usually when it comes to, let's say, breads, you can't, usually patients that have IBS, they struggle with wheat and rye, but like spelt doesn't really cause any issues for them, and that contains gluten, but it doesn't really cause issues for them. And actually, it's been more and more coaches and athletes incorporating low FODMAP diet before competitions, just to slow down the risk of having GI issues. So I personally do it myself with a lot of athletes, because usually when you are close to competition, you start to get nervous, and some people actually, I have a couple of athletes that develop lactose intolerance the last week before competitions, but usually they're fine with drinking milk, and it's probably have something to do with them being nervous or something like that, and it's causing some imbalance with their enzymes. But usually what we'll do is low FODMAP diet, we'll switch to lactose-free products the last week, we'll scale back on the fiber, and that usually helps a lot with their digestion. But I'm not saying that there aren't any people that might have non-celiac gluten intolerance, but I think it's way lower than what you get the impression of, because nowadays everybody's allergic to gluten, and so I think it's more. I've had several people say to me, well, I'm allergic to milk and I don't tolerate gluten, and then after doing some trials and errors, it's basically the FODMAP. So we start to include lactose-free products, and we just eliminate the carbohydrate that's causing the problems, and they're completely fine with both the gluten and the dairy in their diet.
Awesome. Yeah, I was going to ask you if you have special modifications for the people you train or work with who have inflammatory bowel disease and irritable bowel syndrome. It sounds like you kind of answered that, though, as far as FODMAP, lowering FODMAP foods.
Yeah, I have good experience with FODMAP. I used to work before I went into sports nutrition. I actually used to work at a medical clinic. So for 2 years, I actually worked with diabetes, cardiovascular disease, but I worked a lot with patients that had GI issues.
Mm.
And I remember looking at research back in 2012 showing early signs of FODMAP being an effective treatment for these things. So I remember some of the doctors that I used to work with, they were like, it's bullshit, and for
Yeah.
IBS it's all in their head, and
Mm.
it's nothing related to what they're eating, because you know if you go back, you would see doctors treating IBS patients with antidepressants because they were saying, well, they clearly show symptoms of depression, and I was always like, well, aren't you maybe thinking that they're depressed because of having IBS and chronically having problems with their GI? Because
Right.
imagine going around having chronic issues with your bowel system. It can be frustrating, and you can like develop suppressed mood from these things.
Sure.
So, but I know also that there's like these serotonin receptors in your stomach that can get affected from
Hmm.
antidepressant, and they can potentially have a positive effect. But then again, it seems to work much better with the low fat FODMAP treatment that we have now for IBS patients.
Yeah, yeah, the pathology and how it works is pretty interesting. And obviously, there's some significant differences between IBS and IBD. But like you said, there are higher rates of depression among those patients. So it does get frustrating, I think, with the medical community when they fail to recognize the benefits of diet there. And I'm definitely not somebody who says, like, we don't need medication, we just need food. But there are certainly studies showing the benefits of low FODMAP diet and other diets for people with GI distress.